Welcome to our comprehensive guide on the Valsalva maneuver, mechanism, and clinical implications. This video will provide an in-depth look at its history, physiology, and clinical applications. We will cover the history of the Valsalva maneuver, its physiological mechanisms, and its significant clinical implications. The Valsalva maneuver was first described by Antonio Maria Valsalva in 1704. He detailed the maneuver in his work De Aure Humana Tractatus. In 1851, Edward Weber expanded on Valsalva's work, describing the cardiovascular changes associated with the maneuver. The physiology of the Valsalva maneuver involves complex reflex mechanisms controlling arterial blood pressure, including baroreceptors, pulmonary stretch receptors, and chemoreceptors. The baroreceptor reflex plays a crucial role in responding to increased arterial pressure, involving the cardiac sinus and aortic arch. When mean arterial pressure decreases, the baroreceptor reflex initiates compensatory responses to maintain blood pressure. Mary's law describes the inverse relationship between heart rate and arterial blood pressure, mediated by baroreceptors. There are several methods to perform the Valsalva maneuver in clinical practice, each with specific applications. The types of Valsalva maneuver include the usual method, standard or quantitative method, modified Valsalva, reversed Valsalva, and unintentional Valsalva. The usual method involves taking a deep breath, closing the mouth and nose, and attempting to breathe out gently. The standard or quantitative method includes blowing into a manometer against a pressure of 40 millimeters per grams for 15 to 20 seconds. The modified Valsalva maneuver is used to terminate supraventricular tachycardia by blowing against a closed glottis, followed by lying down and raising the legs. The REVERT trial demonstrated the effectiveness of the modified Valsalva maneuver in increasing relaxation phase venous return and vagal stimulation. A 10 milliliter Terumo syringe is effective in generating the recommended intrathoracic pressure for the Valsalva maneuver. The reversed Valsalva or Miller's maneuver involves an inspiration attempt with a closed mouth and nose, reducing intrathoracic pressure and increasing venous return. The Valsalva maneuver can also occur unintentionally during activities like lifting heavy weights, coughing, or straining. The hemodynamic effects of the Valsalva maneuver include changes in blood pressure and heart rate influenced by mechanical and autonomic factors. The cardiovascular response to the Valsalva maneuver involves both mechanical impact and autonomic nervous system involvement. Regulatory mechanisms during the Valsalva maneuver include